Hi everyone, welcome to the 2022 Early Childhood Voices Conference. My name is Leslie Kokotek, and I will be sharing this presentation today on behalf of myself and Dr. Karla Washington. We're pleased to be able to share some of our research today on understanding the functional communication of bilingual children. Before we get started, I just want to take a quick moment to briefly introduce ourselves. Dr. Washington is an associate professor at the University of Toronto, and she is also the director of the Pediatric Language Learning and Speech, or as we refer to it, the PEDALS Outcomes Lab. And her research and clinical interests focus on speech and language development for monolingual and multilingual preschoolers. Dr. Washington is also active in NIH-sponsored research characterizing Jamaican children's speech productions and functional communication. And in addition to this, she is also an invited member of the International Expert Panel on Multilingual Children's Speech. Prior to Dr. Washington's new role at the University of Toronto, she served as my dissertation advisor at the University of Cincinnati, where I recently completed my dissertation on functional communication of bilingual Jamaican preschoolers using both quantitative and qualitative methods. And for this presentation, we want to share with you the aspects of the qualitative work, which looked at understanding bilingual Jamaican children's functional communication from a parental perspective, specifically within the context of the COVID-19 pandemic. That said, we know 10 to 15 minutes that are allotted for this presentation today is not nearly enough time to comprehensively cover all of the details of this investigation, but we do want to provide some general details about the background information that led us to this investigation and the relevance of the International Classification of Functioning Disability and Health for Children and Youth, as well as review our study design and methods and conclude with our results and implications. So in general, what we know is that evidence-based practice refers to three equal and multi-directional components, which are best research evidence, professionals' clinical expertise, as well as clients' informed preferences, which are outlined here in this graphic. What we also know is that children's language functioning, or how they use their speech and language abilities in everyday situations, and the accurate determination of their speech and language abilities are directly linked with their future academic achievement, their participation in society, and even their overall quality of life. Yet at the same time, in the field of speech and language pathology as a whole, there's really a general lack of information available regarding children's functional communication. And that limitation is not only exacerbated in the multilingual context, but the limited amount of information that is available is heavily centered on professionals' clinical expertise and best research evidence that doesn't include much in the way of clients' informed preferences. And to make matters even more difficult, we certainly didn't have maybe any data prior to 2020 that would help us to understand how children's speech and language abilities could be affected by pandemic-related restrictions. So in order to better understand how bilingual children use their speech and language abilities in their everyday lives, while also considering the possible influence of the COVID-19 pandemic, we looked at the ICFCY as a holistic framework that could support us in gathering information about the functional communication of bilingual Jamaican preschoolers in the COVID-19 milieu in a way that was sensitive to the cultural and sociolinguistic features of the Jamaican community. For example, Jamaica is considered a bilingual nation where many people grow up as simultaneous bilinguals. In other words, they grow up speaking both Jamaican Creole and English from birth. However, even though Jamaican Creole is considered an independent Creole language, it emerged because of slavery during the colonial period. And this historical context has influenced many of the attitudes and beliefs surrounding language prestige, where Jamaican Creole has historically mostly been an oral language that is considered to be more the language of the people that's expected to be used in more informal interactions, while English has been viewed as the prestige language that is used in more formal settings, such as academics and business. But language use in Jamaica has also been noted to occur across the linguistic continuum, where code mixing is expected and occurs to varying degrees depending on the situation. So with that in mind, we wanted to use measurement tools that emphasize the participation component of the ICFCY and also how Jamaican children were using their speech and language abilities as a social tool while also considering the language-specific parameters in a way that was responsive to the contextual factors relevant to Jamaican culture and also to the COVID-19 pandemic. These considerations led us to concentrate our qualitative efforts on several assessments that were initially used for their intended quantitative purposes, but being aligned with the different components of the ICFCY, these assessments could be used to help situate parents to different aspects of their children's functional communication to facilitate our qualitative investigation. More specifically, the focus on the outcomes of communication under 6, or just the focus, is an assessment tool that measures children's communicative participation that was used for the secondary purpose of helping to orient parents in thinking about how their bilingual children use their full repertoire of speech and language abilities across both of their spoken languages as a social tool in their everyday lives. So to do this, we asked the question at the end of the focus assessment: when you think about your child today, how would you describe their communication? We also used a similar approach for obtaining qualitative responses from parents about their children's functional speech intelligibility using the intelligibility and context scale, and also the Jamaican Creole version, or the ICS and the ICS-JC, in sessions counterbalanced by language, where at the end of each of these assessments, we asked parents, when you think about your child today, how would you describe their speech? In following the administration of the ICS and the ICS-JC, we also asked parents to provide estimates of how often their children heard and spoke either Jamaican Creole or English at school. And although we did not specifically ask a secondary qualitative question following these extended specific language use forms, many of the parents spontaneously and organically offered more detailed descriptions and explanations for their answers, which we then incorporated into our qualitative analysis as a means for better understanding children's communicative functioning in relation to how and when Jamaican children use each of their spoken languages. We analyzed this data using a systematic 3-phase analysis that essentially constituted an inductive but modified grounded theory approach that incorporated features of a content analysis. Our participants included the parents of 34 Jamaican preschoolers between the ages of 3 and 6 years old who participated in 45-minute semi-structured interviews where they answered qualitative questions facilitated by the focus, the ICS, the ICS-JC, and with a slightly lower response rate to the specific language use forms. Again, because parents were not prompted at the end of the specific language use forms to provide a qualitative description, rather, many of these parents again spontaneously provided that additional qualitative information. Here you see just a quick overview of all 3 phases, where phase 1 consisted of an open coding process and provided the data that was needed to complete the content analysis and axial coding process within phase 2 that eventually resulted in the generation of our major themes. And then lastly, phase 3, which included a reliability analysis simply to ensure coding stability across independent raters. And I do also want to highlight that we completed all 3 of these phases in relation to each of the 5 forms so that we were able to generate themes that reflected the different aspects of Jamaican children's functional communication. Looking at phase 1 more specifically, using an example from parent responses to the Jamaican Creole language use form, each independent rater completed an open coding process where they segmented comments from parents and labeled them according to the main concepts or ideas. These labels were referred to as minor themes and were then tallied so as to provide an objective guide for how to categorize data within phase 2. And here we see an example that illustrates exactly what that open coding process looked like, using an example from Rater 1, where they segmented a parent's comment, then developed labels based on the concepts identified within each of those segments. And those labels were then referred to as minor themes that were either a novel generation or were established from a previous parent comment coded earlier within the first phase. Also, we feel it's important to note here that the raters considered that each segment could have more than one meaning. So you can see within this example that the middle segment was actually coded into 2 different minor themes, as the rater considered it to have more than one meaning. The flow chart here illustrates the phase 2 process, where the minor themes were organized per form, beginning with the most frequently occurring minor themes that then guided the research team in organizing and collapsing the data into different categories and groups. And that data was then used to generate the major themes, which ultimately were the results of our study. And once those major themes were determined, phase 3 of the analysis was completed so that we could consider the coding stability across independent raters. And here we provide an example of what that looked like, where the raters used rich text formatting to recode the parent comments per form using the newly generated major themes. And then we note that the reliability for this was achieved for all forms at substantial to almost perfect agreement. So ultimately, this 3-phase analysis resulted in major themes for each of the forms reflecting different aspects of Jamaican children's functional communication. And as you can see here, some of the major themes do overlap across different aspects, such as themes related to reduced opportunities for children to experience and learn Jamaican Creole. When considering each of these themes pertaining to the different aspects of Jamaican children's functional communication, we really want to underscore the insights regarding the stakeholder or parent perspectives regarding Jamaican children's functional communication, as well as their expectations about how and when children use Jamaican Creole and English, and notably how parents have identified the shift in opportunities for Jamaican children to use Jamaican Creole, which is considered to be an integral part of Jamaican identity. But in summary, these findings really provide new information for informing evidence-based practices in the broader multilingual context, and also to help us understand the challenges that Jamaican children and their families encountered during the midst of the COVID-19 pandemic, and how those challenges have influenced children's functional communication. These findings also offer new insights and considerations for identifying barriers to infrastructure, education, and also health and well-being that may be useful for supporting different aspects of functional communication for not only Jamaican children, but also for the broader range of multilingual preschoolers. So that brings us to the end of our presentation today on understanding bilingual children's functional communication. Dr. Washington and I would like to extend our sincerest thanks to all of our viewers today. We hope you enjoy the rest of the ECV conference.